next public comment speaker is Mr. Noah Louis-Ferdinand.
Thank you. This is Noah Louis-Ferdinand. I'm the communications coordinator for Voices for Vaccines. I wanted to talk about the COVID-19 vaccine for kids and the decisions surrounding it. This is a topic that has become mired in a lot of politics, including mandates, which I just want to make clear the CDC does not have jurisdiction over. But I want to move past that. We all understand that COVID is less of a risk to kids than adults, but that does not mean no risk. We know that somewhere north of 100,000 kids have been put in the hospital by this disease, and the exact number matters less than what that means in the real world. I wanted to give some examples from my local area, Metro Detroit, where I spent much of the pandemic. The city of Detroit has produced data showing parents feel less comfortable going about life than people without children, whether or not they themselves are vaccinated. To quote the report, this suggests that vaccine hesitancy does not reflect doubts about the seriousness of COVID-19. In Flint, just north of me, the public health manager has also told me they've had trouble getting kids vaccinated. But here again, that does not mean COVID isn't having an impact. And much to the contrary, their schools were closed for in-person instruction this past winter into February. Now, we all agree that's an issue, but it's also not some arbitrary decision. It's the reality that you take a district that has plenty of challenges already, and then you add a surge of disease. We have good evidence that says even a case of flu can cost hundreds of dollars in a household with kids in terms of lost productivity, medical costs, and other things. That is not easy to deal with. And COVID is, of course, much more contagious, much more disruptive, and costly than flu is. We have hard evidence that it did cause disruption in these cities, just from what happened. So the question we have to ask ourselves is, if we're serious about making things feel normal, how do we actually support communities across the country in dealing with COVID going forward? Because it's not going away. I think removing barriers to protection and increasing access is a key step, which is exactly what adding the vaccine to the Vaccines for Children program does. I finally want to address this point that it's not worth vaccinating kids because the risk is low. And when I hear that, I just have to pause and make sure we really have thought through what we're saying. I met a parent just 2 weeks ago who actually lives a few minutes from my house. His name is Zachary Yaksik. He's someone who lost his daughter Alana to influenza because she wasn't recommended to get the flu vaccine back in 2003, kind of with that same thinking that she was low risk. Later, the recommendation would expand. Alana's tragic death happened almost 2 decades ago, but that is obviously not something that leaves you as a parent. Zachary's been advocating in my city and others around us for almost 20 years to get other kids vaccinated, so it is clearly having an impact in his life and that of the people around him. These things do matter, right? In real-world communities, we try to look out for each other. We're not just going to ignore the impact of a disease. And so I think the want to protect ourselves and each other has to take precedence over politics and secondary considerations. I appreciate ACIP's dedication to making the protection more available and more accessible for everyone. Thank you.